so we acknowledge that this is a terrible incident. The Northern Territory Government stands by to offer whatever assistance is required. We have stood up a number of systems in the Northern Territory to respond to this incident. We are well resourced and well practiced in the Northern Territory in responding to emergencies. We have declared a Code Brown at Royal Darwin Hospital. A Code Brown is a management tool within the health system to acknowledge an external incident will have an impact or could potentially have an impact on our hospital. I'd like to thank all of those on the front line who have worked throughout today and will continue working. To our health staff, to Northern Territory Police, to CareFlight, to the National Critical Care and Trauma Response Team, and also to both the Australian and US military. The Northern Territory has a long and established relationship with the United States. Our thoughts are with them and their families. What I can say, and it is similar to what the Commissioner has just advised, is from initial reports we know that there was 23 people on board. All of them are US Defence. One patient is in Royal Darwin Hospital in theatre being operated on presently. 4 more patients are in Royal Darwin Hospital. We have more arriving as we speak. We are triaging at the airport with the National Critical Care and Trauma Response Team, with CareFlight, and some are going straight to the hospital. We are responding with both helicopters and aeroplanes, and so the helicopter can go straight to Royal Darwin Hospital. The aeroplanes will be triaged airside at Darwin Airport. Australia and the US are working together to respond to this incident. From the Northern Territory Government's perspective, we just held an emergency cabinet meeting. As you heard, we already had the emergency operations team stood up because we have been experiencing catastrophic bushfire conditions in the Territory. We immediately pivoted to respond to this emergency and we held that SEMSI meeting. The Commissioner has explained what is known and the next steps. We're using CareFlight airframes, like I said, both fixed wing and rotary, to respond to get those people to Darwin and to the care that they need. I would like those who are watching this to know that that is our ultimate priority right now, is getting people across from the island to Darwin to receive that care. The site has been secured with Defence and Northern Territory Police on Melville Island, and we also have the Australian Defence Force along with Defence personnel from the US that were participating in the exercise have stood up a response. Additionally, I have kept the Prime Minister and the Deputy Prime Minister updated, and I have also reached out to the United States Consul. We have seen visits to the Northern Territory by both the Ambassador and the Consul, and we wanted to make sure they knew every resource in the Territory was focused on this tragic event. Just in closing, I've also spoken to the local member of the Northern Territory Parliament. This is a very remote area of the Northern Territory, and there was no locals, as we understand, involved or impacted, but we want to make sure that they have information to hand and that we support them as a community. Both the Commissioner and I are happy to take any questions you may have. Thank you.